what are the rates of addiction, or who has the highest rates of addiction among all the different fields of medicine? Anesthesiologist is the highest, followed by internal medicine, surgery, and psychiatry, and oncologists and drug addiction researchers tend to have the lowest rates. In regards to why anesthesiologists may suffer more than some of the rest of us, there's a lot of different theories about this. One theory that's not up there is that potentially there's some subconscious thing going on where people who go into anesthesiology may be subconsciously attracted to a field where they have such great access. Another theory is called the environmental sensitization hypothesis, which talks about how people who are exposed to ORs and ICUs that have all this potentially habit-forming medicine in the air, perhaps it's like a second-hand exposure and it sensitizes the brain and increases the risk. In regards to illegal prescription drug use, out of all the physicians out there, not everybody writes Xanax or Percocet for anybody who walks in the office, but about 1% to 2% of physicians are what's called free prescribers. Basically, if somebody comes in and complains of a little anxiety, they get a medicine or prescription, and that leads to a really high black market out there that probably helps propel a lot of this problem in our society, especially here in America, but overseas as well. Also, physicians themselves who may get started on a pain medicine for actual back pain. When that medicine is taken away, they may actually get to the point where they're prescribing medicine to family members and taking it, or even writing prescriptions for themselves. And that's something that the medical board definitely doesn't look highly on. So what are the statistics for residents? The one thing about all these statistics I have is that they're really old, because most of us as physicians, medical students, don't want to admit if we have a problem. So it's really hard to get accurate, up-to-date statistics on people. But back in '87, residents were 6 times more likely to use sleeping pills than the general population. They had higher rates of benzo use and alcohol abuse, but they did have lower rates of illicit drugs. In 1999, a survey among pediatric residents showed that 22% So what about you guys, medical students? Again, these statistics are again old, but up to 10% had used marijuana. You guys are 3 times more likely to use tranquilizers and psychedelic drugs. Actually, nowadays, there's a lot of people who will use stimulants like Adderall or Ritalin to help them stay up late at nights and focus on studying. I remember back when I was a student, everybody used something called Minithins, which is ephedra. That's not really widely accessible anymore, but we all use that to stay up at night and cram for tests. So I've talked a little bit about the chemically dependent physician, but what about those of us who may suffer from mental illness? Well, unlike Charlie Brown here, who's actually seeking out treatment, most of us tend to take this approach and try to heal ourselves. And how does the medical board define impairment in regards to mental illness? Again, it's the inability to practice the acceptable and prevailing standards of care. As opposed to chemical addiction, if you're presented with an application and you've had a major depressive episode that's received treatment and you're doing well, you don't technically have to check the box that says you are suffering from a mental illness that's impairing your ability to function or provide a good standard of care, because you've received treatment or you're continuing to be in treatment. So that's something to keep in mind when you fill out your medical applications, medical license applications. But still, most of us, even if we have an inkling that we have a problem, are going to have some difficulties seeking out treatment. And why is that? A lot of that has to do with stigma. I'm going to blow through a lot of this just for the lack of time, but our society in general tends to look on mental illness as very negatively. Most people with mental illness are portrayed as violent or even homicidal in the media, all the movies that are going on. And when something does happen by a mentally ill patient, like just recently someone killed over in the Columbus area, I believe, someone killed some of their family members and then shot themselves. It's everywhere. But really, those cases are usually exceptions to the rule. And in regards to celebrities, and many celebrities actually nowadays are starting to come out about the positive benefits of seeking out mental health treatment, like Brooke Shields. But there's still some people out there like Tom Cruise who seem to say seeking out mental illness is a weakness. A lot of our society still looks at going to see a psychiatrist as something that's a negative thing to do or something that signifies a personal weakness. And all of us here have some type of condition that may be considered devalued by society, but not all of us will be stigmatized for that condition. So, in regards to mental health, there's a lot of words people use. Even kids will use the words crazy, nuts, bipolar, schizo. And if you really think of those words, and even think of the way some institutions have used mentally ill or have identified the mentally ill in the past, if you think of these words, most of you may feel kind of like this negative feeling when you think of this stuff. And that's really kind of what the whole concept of stigma is about, is that stereotypes are formed because we all stereotype people. It's a way we can conserve our cognitive faculties in order to understand this chaotic world better. So when we're grouping people together and trying to understand them, that's something we naturally do. We really can't avoid it. But when we start to think in terms of a rigid way and associate those rigid thoughts with negatively tinged attitudes or emotion, that's when prejudice comes in. We actually prejudge people based on some big thing and we really don't allow ourselves to know the real person, and so prejudice comes in and they're unreasonable and overgeneralized. Then prejudice, again, lead to discrimination, which is all something we want to avoid. So, in brief, stereotypes convey the cognitive aspect of group differentiation. Prejudices connote the affective or emotional aspect of such differentiation, and discrimination pertains to the responses that result. So the mental illness prevalence rates, up to 46%, or nearly half of us and the general population have or will struggle at some point with mental illness at some point in their life, up to a quarter of us in the past 12 months. And most of these cases are mild to moderate symptoms, but up to 6% will have a serious disorder that interferes with their ability to perform at their job, to really be able to function at home. So in regards to physicians, again, the incidence rate is elusive. It's hard to get good statistics, but we suffer at least as much as does everyone else, and we may actually have higher incidence rates of mood disorders, and we have higher suicidal rates. Many of us function remarkably well at work in spite of severe psychological difficulties, and as with addiction, people who are mentally ill, even though we may start suffering symptoms earlier, we don't actually get hospitalized or receive treatment for those symptoms till later in life. And why don't we seek out treatment? Well, there's potential problems with our health care. Many people who go into private practice actually don't even get health care, or they just pay for it when they need it. That may be changing with health care reform. And as far as medical students, those who've suffered from a depressive episode, only about 1 in 5 of them have sought out treatment. And if they're suicidal, only about 42% have sought out treatment. The biggest thing people point to is why they don't seek out treatment is lack of time, fear of documentation on their academic record. That's a big one. Lack of confidentiality. So you may be thinking, what happens to me if I'm diagnosed with a mental illness or alcoholism or addiction? Should I try to hide my symptoms? Should I self-medicate? I definitely should not let the state medical board find out, should I? Will I lose my medical license? Will I be in trouble if I choose not to disclose my mental illness or addiction, but the medical board finds out? Well, I'll just briefly go through a few case reports about people who've struggled with some of this stuff in the past. And, again, we're potentially one of the statistics. Hopefully you guys don't have to suffer through this, but at one point in your life, you may know someone, even if you don't suffer yourself. So how about we just go through a little history. Clifford Beers, he was an individual who likely suffered a psychotic episode associated with a major depressive disorder or bipolar disorder years ago, and he was hospitalized. And he recognized all the appalling conditions in an institution that he was hospitalized at, and then he later advocated for reform and ended up opening the first outpatient mental health clinic in the nation.